with us. So Robert Wood Johnson Barnabas made them come to the street with us. So if we can all have a round of applause for these young nurses. Here they come. They did not have any say in it. They did not vote, but they are here standing with us. So we have, I believe we're one of the top 3 states in the country that has a big nursing shortage, and these nurses are out here. So how can we be treated like a family? I believe last week there was something out. How can we be welcomed back by Alan Lee? Well, Alan, just sit down at the table and we'll figure out how to welcome us back. Our members have been called nonsensical for speaking from their heart. They tell us we're the highest paid in the state. They tell us that we have safe staffing. I have binders here, 406 unsafe staffing protest forms. That means at least every day over the past year, that staffing was not safe. I will mail those copies to the magnet, to the DOH, and anybody else that will listen to us. Also a letter, I don't know where Erica is, we're gonna write a letter to Magnet. We wrote it, we're gonna tell them and send them their unfair labor charge. When I spoke to them the other day, they want that. They welcomed the traveler nurses as heroes. We are the heroes. We are the one that made that a level 1 trauma center, a comprehensive stroke center, a comprehensive cancer center, the Beacon Award winner many times, 6 times Magnet, and we are dismissed by management. We are not disposable. We are the nurses, the Robert Wood nurses. Just because they don't want to be held to a safe standard if someone calls out. We go in there, we worked COVID, we worked pneumonia, we work flu, we get spit on, punched on, and we still come to work. Our benefit is sick time, and they want to penalize us for sick time. How do you treat your family like that? They said about healing the wounds. Some wounds will never heal. The cruelty that has been shown to us and inflicted on us, but we will make, as nurses, we will go back in there. We will hold our head up high the day we have to go in there. We will be unified. We will survive. There are many jobs out there, but we want our jobs back. It's time for them to come to the table and start talking seriously, and it's time to pass the S304 Safe Staffing Bill. And without further ado, I would like to welcome Senator Linda Greenstein. Senator.
Thank you so much. Good afternoon, and thank you for inviting me here today. I'm proud to stand in solidarity with the Robert Wood Johnson Barnabas nurses in support of better, fairer working conditions. Our healthcare workers, am I speaking in that right? I hear a buzzing. Is that okay? Okay. Our healthcare workers are the backbone of medical care in our state. For 3 years now, nurses have worked tirelessly through one of the most prolific moments in our country's history. Their dedication to service is invaluable. I know we've said it before, but it bears repeating. These men and women are heroes. Heroes. So, let me just put this. They are the men and women taking care of our mothers, our fathers, siblings, children, friends, and loved ones during some of our darkest times. Through it all, they are the individuals at the patient's bedside. And like I said, during the pandemic, we hailed our frontline healthcare workers as heroes. They deserve this continued respect. We need to show them we mean that. We need to establish standards that will improve working conditions at our hospitals. Nurses cannot help us become better if they are not being supported by their employers, if they don't have the time to spend at each bedside, if they aren't rested and clear-headed. That being said, one necessary step toward progress is safe staffing. Making sure that our hospitals and healthcare facilities are adequately and properly staffed means the staff will be well equipped to provide exceptional patient care and ultimately to save lives. I'm one of the sponsors of S304, a bill mandating enforceable nurse staffing levels in hospitals. Now more than ever, we need to take meaningful action to stop the exodus from our hospitals of dedicated, courageous nurses and other healthcare workers. This is our challenge, and I will do my best to make sure we meet this moment. Thank you all very much, and thank you for your service.
Thank you, Senator. Thank you for taking the time out to come here. And we can only hope that we're back to work before the bill is passed and that we resolve our issues before it is passed. So again, I'd like to thank Senator Greenstein for coming here and for continue to support the bill that, again, we wouldn't be out here if we had that bill. So S304, please. And I guess if our governor's listening somewhere and not at a Bruce concert or a Beyonce concert or some concert, maybe he will hear that. I'd also like to introduce Charlie Wokowski. I'm going to mess his last name up. I'm not very good with names, unless it's like Max. Charlie is with the AFL-CIO, and he has helped us tremendously organize all of these speakers and doing his own part to speak to the governor and anybody else he can. So, Charlie, I'd like to introduce you.
Thank you, Judy. My sisters and brothers, Senator Linda Greenstein, thank you so much for coming up here today. Thank you for being a co-sponsor of this very, very important piece of legislation. But I'd like to just say a few words, and I always start out when I'm dealing with the healthcare professionals. I'd like to say thank you for everything that you do. You are a tremendous group of people. You are courageous to be out here under these circumstances. And you know, I heard most recently of the extension of the scabs that they're going to continue to hire. I heard most recently about the issue of cutting your health care benefits, which is despicable. And I think God has a special place for people that do these kind of things. Our day is coming. I'm going to tell you something right now. They may think they're going to squeeze us because they cut our health care. They may think they're going to squeeze us because they brought the scabs in for another 30 days. But they're going to learn a lesson here in New Brunswick that they'll never forget, that we're going to beat them, we're going to last them one day longer, and they'll never, ever try to shit on us again. God bless each and every one of you.
I know some of the nurses wanted to speak. One of them, Nancy Lipschitz from CCU, she is sick today. She was at the South Plainfield rally yesterday. She was at the Rutgers game, so Nancy has gone above and beyond, but Nancy is not feeling well. So I will introduce Mary Lynn Dupreez. I believe she's going on 35 years now, commitment to that hospital. She was a PICU nurse for many years. She is now on the PH transport team, and she can talk a little about how the health insurance, losing that affects her. So she is also a Magnet Nurse of the Year. So a warm adieu to Mary Lynn.
Thank you, Judy. As Judy said, my name is Mary Lynn Dupuis, and I've been a pediatric ICU nurse and a transport nurse here at Robert Wood. Next month, I'll be here 35 years. My first ID says Middlesex General Hospital, actually. Wow. I've been involved in the culture and the growth of this hospital to the point where I feel like I'm part of the mortar and the bricks of the building. There's been so many ups and downs throughout my time here, from the strike of 2006 to my husband's diagnosis with leukemia in 2001. After his bone marrow transplant, his immune system never recovered. It took us years to figure that out. And we've worked very hard to keep him healthy. He gets an infusion once a month over a whole day and 4 medications to keep him healthy. He had a recent ER visit here, I'm adding this in, and his nurse had him and 21 other patients.
Nice.
Now that the hospital has made the cruel and unnecessary decision to cut our health insurance, I'm going to be taking COBRA. I have really no choice. I can't afford to risk all the progress we've made so far. My payment will be $1,794.96 a month, and I will be moving money from my retirement and my savings account to pay this premium. Money isn't my only concern here. Patient care and dignity is why I and everyone else is out here and has been for all of these days. I myself was a patient here about 1.5 years ago. I had a knee replacement. Yay, OrthoFloor, that took care of me. I wasn't able to get up. As you know, you can't get up the first night post-op. And I had to go to the bathroom. Not so bad, so I pushed the call bell. 2 hours later, finally somebody came to help me to the bathroom. And the nurse who cared for me greeted me with an apology. I'm sorry. I have so many other patients that all needed help getting to the bathroom, needed their medications. After my recuperation and I came back to work, I started listening to my coworkers. We all greet our patients with an apology. I'm sorry I couldn't get that Tylenol to you soon enough. I'm sorry I couldn't get those ice chips here sooner. I couldn't get here sooner on transport. Nobody wants to greet their patient with an apology. Many nurses also, what I'm finding, my colleagues are leaving their shifts and saying, I did the best I could. I did the best I could today. That's not good enough. I leave here and want to say I gave 150% to every patient I took care of, but we're being stretched beyond our physical, emotional, and professional capabilities with the assignments that we're being given. We know there's a better way, and our patients deserve better. This is what drives us. This is what makes us a family. I call upon the hospital to treat us with the respect, the commitment, and the dedication we've shown them all these years. Thank you very much.
Thanks, Mary Lynn. Again, these are the faces of the hospital. It's not the travelers and the scabs in there. We are the nurses, the Barnabas nurses. I hate to say that word, but we are the nurses. I have one of the new orientees, I don't even know what to call them, orientees, probationary employees, who were told they don't have a use for them. So David would like to come up and say a few words. Give him credit for that.
Hello? It's a very sad moment for some of us. 90 days after our orientation, we're supposed to be with our patients, but the hospital asked us to join our preceptors. These nurses standing here are the ones that was training us, giving us the basic, the tools on how to take care of our patients. Some of us, within 2 months or 1 month on our probation, they were left to come to the streets because they couldn't meet their condition. And immediately after our 90 days, we're supposed to be in there. They said we're supposed to join our preceptors. Today, we are here in solidarity. I know the strategy is to send us out here, so when the union goes to a second vote, we will vote against the strike. We're not going to do that. We're going to support in solidarity that safe staffing is matter, and it's now. On behalf of the new orientees and the 90 days patients with RWJ Barnabas, we are sorry to be here, but we are happy to join you to fight this cause. We have an option. As a new orientees or new nurses, we have an option to join Hackensack Hospital where they can pay us $48 an hour. But we cannot do that. If we do that, we betrayed our preceptors. The very first nurses that gave us the tools on how to take care of those patients who are on the bed. We thank you all for the fight you've started, and we are willing to join you now. Safe staffing now.
David. David, I don't know what floor you're going to, but they're lucky to have you. And all the nurses that are there. I see my 7 Tower Polly there, who she was probably going to be trained by 2 of our best nurses on 7 Tower, but she stands with us today as well, and the rest of the nurses there. I'd like to take a moment to introduce Krista Fisher. I got the name right. She's going to speak just on behalf of the community and on behalf of how, when her child was a patient at Robert Wood Johnson, they got the care they deserve because the Children's Hospital gives great care. So without further ado, Krista, I introduce you.
Thank you so much. I spoke about a week ago about my family's situation and how we became frequent flyers at Robert Wood Johnson. Barnabas. We received excellent care from nurses who knew my son so well that when there was something wrong after a surgery, they saw it. And with this, my son today is celebrating his first day of pre-K, and I don't know if he would have been if this wasn't caught. So I'm here today and I'm going to continue speaking, even though I hate public speaking and I'm very nervous, but it's important for me to be here as a mother for the nurses in the ER and the pediatric unit who've just made my family feel so comfortable. My son has VUR, so that comes with a lot of hospitalizations, a lot of random trips to the ER. And I'm gonna have to drive 2 hours away to Chopped because I am not stepping foot in that hospital. I mean, except to go get my car for coming here today, but that's it. I do not agree with this administration. My emails have gone unanswered, and I'm disgusted that these nurses who literally just gave us so much hope during our stays are being treated this way. When 2 years ago, administration was bragging about our hometown heroes, where are they bragging now? The treatment that they are giving you is despicable. And I want you guys to know that maybe not all patients' families are coming out here, but we see what's going on. And I just encourage you to not lose. I don't want you to lose that steam and that passion. I'm not going back until you guys are back. Thank you.
Thank you, Krista. I wish everybody felt the way you do. But again, one day we will get back in there. Anyway, I believe John Sue would like to say a few words. And I have to give a special thanks to all of the procedural areas who come out here day after day after day. I mean, you can't say enough, the OR, the cath lab, the endo that are out here. Their staffing is not, many of them were floor nurses, so they know what it's like. Same day surgery, medical, same day, all of them. They know what it's like, and they know the potential that without a union, what they would be facing in that hospital. So we deal with safe staffing every day, and I thank them from the bottom of my heart for coming out here, for showing the support, for showing solidarity, because they are some of our strongest groups. And to all the people, the procedural areas and all, you can come look at our safe staffing books if you want, but they are here. But I'll introduce John, and he wants to say a few words.
Thank you so much, Judy. My name is John Shu. I was a delegate for Bernie Sanders in 2020. I was the chair of the Progressive Caucus of the Edison Democratic Organization. Also the chair of Our Revolution, a political action group here in Middlesex County. I'm here to give you a straight talk about how politics works here in Middlesex County. Some of you may have heard about Jack Morris. If not, let me introduce you. The cancer center here will actually be named after him. And he also happens to be the chairman of the board of Robert Wood Johnson University Hospital. How is a developer, a principal owner of Englewood Properties, and managing partner of M&M Realty Partners with no healthcare background get named the chairman of the board of Robert Wood Johnson? The story starts in the early 2000s. Jack Morris was a business associate with the former New Brunswick mayor and former state senator John Lynch, one of the most powerful political figures in New Jersey at that time. However, in 2006, John Lynch went to federal prison for mail fraud and tax evasion. And you can read about some of the history in a New York Times article from 2006 entitled, "New Jersey, Party Bosses Meld Politics and Business." And here we are in Robert Wood Johnson, a place where business and politics have indeed been melded. We can see that in the staff ratios, in the administration's steadfast efforts to break the strike, and we see that personified as Jack Morris, a politically connected businessman who has no business being the chairman of the board of a hospital. Make no mistake about it, Jack Morris's political influence continues to this day. In Piscataway, he was able to influence the zoning board, which is selected by the mayor and the council, to allow a variance to build warehouses on a property zoned for farmland. This is a property 500 feet from Randolphville Elementary School. What kind of person builds warehouses next to an elementary school? Someone who puts profits over the welfare of people. Now I'm going to talk about something a little controversial. We are always told about the importance of voting. We have elections every year in New Jersey, every year. And I encourage people to vote every year, especially in June. And June is the most important election. That's the primary election, because we are a Democratic county in Middlesex County. So typically what happens, whoever wins in June will win the election in November. So that's why June, always remember, June is the most important election. But voters, we also need political knowledge to make the best choice. Here in New Jersey, we have a ballot structure that is unique to the whole country. No other state in the country has a ballot like ours. The ballot structure is used by the leadership of the Democratic Party, the same party aligned with Jack Morris and other businessmen to influence politicians, to pass bills that the party leadership wants, and also to pass bills that the party leadership does not want. And that includes S304. Politicians do their bidding, because once a politician is kicked off the team, they will be removed from the column that's labeled the Middlesex County Democratic Organization. This is the line, the county line that has been talked about quite a lot in the press. And they will likely lose their election, even if they are the incumbent. So too many voters just vote down the organizational line, not knowing that the ballot structure is there to manipulate them. But you can fight back against Jack Morris and his allies in the ballot box, not by default voting for the Middlesex County Democratic Organization in every June election. The most important seats in the Democratic organization are 7 county commissioners. They are up for election every year, and they rotate every 3 years. One thing that the county commissioners did was they passed a bill to give $25 million to the developer here. Just Middlesex County taxpayer money. No stipulations, I think because they were friends. And if there are brave souls that will oppose this team, they will likely be on the ballot in the future elections as the Democrats for justice, fairness, and transparency. And my hope for speaking out is not that the Democrats for justice, fairness, and transparency win in any election. It's so the hospital administration comes to the bargaining table in good faith so that these truths are not spoken about anymore, even though they still need to be. Because I am speaking the truth that the leadership of the Middlesex County Democratic Organization does not want spoken. And I speak passionately for you because I believe in your cause, I believe in safe staffing, I believe in labor, and because I fight for the same alignment of forces that want to build a 7th power plant in Middlesex County, in the Caseby section, in the poorest and most diverse section of Woodbridge. These are the same forces that denied the teachers at Middlesex College a raise or new contract for 3 years after calling them heroes throughout the pandemic. I'm sure that sounds familiar.
Yes.
And also, these are the forces that did not use any of the COVID money for the teachers at Middlesex College or for the nurses here. And instead, they're planning to build a new stadium in Middlesex College for Rutgers baseball.
Sounds familiar.
And I hope you see that our fights are aligned, that we, the regular people, if we work together, we rise up and we can build a better Middlesex for all. Thank you.
Thank you.
Thank you, John. I think through different investigations and stuff, we have seen that Jack Morris owns a lot of property. He owns, I believe, the whole Obridge Plaza by the Costco over there. He owns places in Bridgewater. He owns places in Piscataway. So he is well connected to this hospital and has a lot of political influence on this hospital. Just to say a word, Carol Tanzi's going to say something after me, but this weekend we have the Maplewood March up in Maplewood, New Jersey. Please go on the link and sign up. We want as many people there. That is the hometown of Mike Manigan, who is the overall CEO, CFO of the Barnabas system. So we're going to go up there. And I think that people have asked, why don't we go to some of the administrators' houses and just walk around the area and just, do our walk. So hopefully they will put that in the works. But please, when Saturday night, we're trying to get buses to go up there. But please, please, please sign up, go up there, show your support. The hall will be closed this Saturday and Sunday. They have an activity going on. The hall will be closed the following Saturday and Sunday as well. So we will not have use of the hall this weekend or next weekend. So I guess you can come to the picket line, but it'll be very limited. And we ask you all join us in Maplewood to do what Hamad and all of them are doing. We will put out a link today to join. I'll let Carol speak too also.
Hi, everybody. So, I just want to piggyback on what John said because it's very important to us. A lot of people have been speaking of their frustrations at coming to the line and we still don't feel like anything is happening. Behind the scenes, we've been doing a lot of things trying to get to influencers, people like Jack Morris, people like Mark Manigan, people who are actually controlling the power players who are controlling what happens to us here because they're trying to protect their profits. What happens here is based on elections, and you can believe it. We are encouraging everyone to take your power back and make a difference by writing the emails, writing the letters. When we stage an action to go to somebody's hometown, come for a ride. Let's do a road trip. When we find out where Governor Murphy's going to be, let's take a road trip. It is not enough to win this strike, as you can see after 32 days just coming to the lines. We're up against a much bigger and more horrible beast than we have ever. We're just peeling back the layers of the onion to find out all the dirty corruption that is involved on us being out on the street right now. Get mad at who you want to get mad at. I'm getting mad at all of them. But I'm going to direct my anger into action because we do have a voice. It is past due that we use it. We've been told all of our nursing careers, yes, doctor, just be polite. Just do what you're supposed to do. Keep your head down. That is over. Those days are gone. We have literally been abused, and it is time now for us to take our 1,700 people power back and harness that to make a change that's going to be real. A bill sitting on a desk for 20 years does me no good. It does you no good, and it needs to be forced. We're going to be having a lot of emails that say, like telling you who to email to. It's important. It's very important that 1,000 go a day. Not me and 2 of my friends. Me and 1,700 of my friends and their families. Get your families involved. Everybody's little old mother who can't come to the picket line, get those ladies on their emails. Give them somebody to scream at. It feels good. And for anybody who has any questions or any doubts about what we're doing, if it's right or wrong, you know in your heart this is right. This is the right thing to do. We're doing it because it is right, and they're fighting us because they know it's right, and they're trying to get their narrative out that we're the wrong people here. We're not wrong, and you know it in your heart, and you know it in your soul, and you see it in your patients' faces. We are not wrong, and we will not let them villainize us anymore. Done. Done. It stops today. We take our power back and we start going higher than these. Oh, I almost said a curse. We go higher than these people. We're going over their head now. We're going to where it matters because these people don't matter to us. We're going to fight this fight so that we get back in this hospital doing what we love to do and doing what we are great at. Thank you, everyone. See you in Maplewood on Saturday.
I think Carol points it out very well. Some people say, what is the union doing? The union is hard at work every single day. I think there's not a day that 6 o'clock in the morning I'm not getting a text, and not at 2 a.m. in the morning I'm getting a text. So believe me, I'm trying my best to answer everybody's questions and get back. As soon as I have news to get back to the table, I will let you know. I have one more speaker. His name is Will. Will comes from the best floor in the hospital because I'm partial. That's my floor. No offense to anybody. I could be Will's mother, maybe grandmother. But since my husband Tom left to go to PACU, Will be my next husband. So Will wants to say a few words. Seven Tower Will has been here. How long you been here, Will?
About a year.
About a year. So Will.
Hello. So as Nurse Judy said, my name is Nurse Will. I'm usually toddling around 7 Tower, terrorizing my coworkers there. But I wanted to bring something up today. Oh, louder? Yeah. This better? All right. It's like ASMR. So, Nurse Will, 7 Tower, usually toddling around, terrorizing my colleagues. But when I'm not doing that, I actually caregive for my grandmother. Her name is Shirley. She calls herself Shirley Whirly. So she is going to be 90 this year, has pretty advanced dementia, but she grew up in the English countryside somewhere, so she sounds like Mrs. Potts and drinks like Betty Ford. She's wonderful, and, occasionally, louder? Now? Better? Okay. So, Shirley Whirly, so she's still has quite a bit of role personality. We'll talk about things. She'll ask me about, is Vera Lynn still alive? How's the war? But occasionally she'll hit on something. So I told Shirley Whirly I was going to be a nurse about a year ago, and she kind of looked at me a little funny, and then she's like, you know what? That kind of makes sense. And I was like, oh, is this going to be a compliment? Like, what? I was like, oh, Shirley Whirly, why? She said, because you're kind. And I think what she hit on there, which is really important, is the psychosocial component of nursing. It's not just the metrics, it's not just how many surgeries go off without a hitch, who gets out of bed. It's our patients leaving not just healthy, but whole. I had a patient, this was a couple months ago, 92 years old, had a stroke, and seemed to be recovering well in terms of her symptoms, but was just depressed, and she was also pretty aphasic. But taking time to speak with her, I found out she was the last of 9 children still alive, having grown up in a farm in Plainfield. And she's like, I realized I haven't shared the memories of how I grew up on the farm, how I used to hang the laundry with my mom, and once I die, no one's going to be left to sort of carry this forward. And the thing is, so we spoke about it, I spoke with her family, and they were able to ask her more because her mom was like, oh, my kids wouldn't be interested. But the important thing about that is you can only do that if you have the time to sit down with a patient for 10, 15, 20 minutes. If you have 6 patients, high acuity, it's not happening. And then you can't, or at least I can't speak for everybody, I personally can't leave the hospital feeling good because it's for every one patient like that who I do talk to, how many stories are left unheard? How many people leave, kind of perfectly healthy, but still feeling like shit because they don't know, what does this mean about my role as a mother, as a grandmother, as a son? Will I still be the friend I always was with these new deficits? And that's certainly something I don't think the hospital takes into account. So moving forward, I think we should definitely keep all of the metrics in mind, but also the fact that what we bring to the table most is that people leave whole. Thank you very much.
And I can actually say as a new nurse, Will gives more, 150% all day. I am like, Will, what are you doing now? Will, what are you doing now? Will is always doing something. He is one of the nurses that does not take a break. He is one of the nurses that stays because sometimes the new nurses we go into the cluster, they tend to get the 6th patient, which is, it puts you over the edge. But Will has gone above and beyond, and I'm proud to say that he does work on my floor because he gives his best every single day without ado. And Will, you know I mean that from the bottom of my heart. I love my Will. I think we all do.
Wedding invitations will be out shortly.
All right. I don't know if anybody else wants to say anything. I just think we need to get back to the basics, get back to the negotiating table, know that we have our staffing protests that have probably every single floor on them. And when the memo came out this weekend about she cured the ED, the only reason that memo came out, I'm sure, is those ED nurses wrote a letter to her, a very scathing letter to her saying, you need to fix the ED. Other than that, it would have gone with whatever this SWAT team is. So the ED has a lot of travelers in it. I think she went to SWAT 6 North next, and I believe they still have the same staffing issues and a lot of travelers. And again, everybody looks at the advertisements of hiring nurses and all of that. They had 125 to 250 travelers pre-strike. So they need to hire people. So when you see the open houses, they have open houses every month. I would not get upset with that because we will need those nurses in there when they get back. So how can they hire the nurses when they put 30 nurses out here? I don't understand it. But in conclusion, if nobody else wants to speak, I just want to thank every single nurse out here, no matter where you work, on this sweltering day, and I think tomorrow is going to be hotter. For coming out here and sharing your stories and just sharing solidarity. One day longer, one day stronger. We will get through this. Thank you.